to help us learn more about cholera. Stay tuned and you can start engaging with us on our WhatsApp number 0708 22232. And our SMS line is 22232. You can also share this link from our social media handles at Top TV Kenya on YouTube and Facebook pages. Good evening. My name is Grace Mutiso and welcome to this week's episode of Health Check. At this point, allow me to introduce Lillyan to us. Good evening, Lillyan.
Good evening, Grace.
How have you been?
Fine, thank you.
Yeah, you know, when I met you, what I liked is your, I call it chaget.
Yes.
It's intentional, you know,
Yes.
you putting it on.
I'm a health promotion officer.
Yes.
And I'm proud of being one.
Yes.
Yes.
What does the health promotional officer do?
Normally, we engage with the communities, and communities not only where we think it's at the household, but a group of people who are sharing common amenities, social values, beliefs, and norms. It could be at the community, at the household level. It could be at a workplace, an institution, in a religious institution, so various places.
Okay.
So our mandate is to help people change behaviors and improve their quality of life. So we have health promotion officers within the 47 counties.
Yes.
Who mainly their role is to educate people on different health matters, also health communication on various health issues, also promoting access and utilization of health services.
Okay, interesting to know, and we're glad to have you on Health Check today. So we are talking about cholera, and I'll just love to begin this conversation by asking how dangerous or serious is it in the country?
At this time, we have 23 out of the 47 counties that have reported cases of cholera within those 23 counties. And during this outbreak, the first incidence was reported in October. And to date, we have not really controlled or say that we are off the hook with the cholera outbreak. So we still are muscling up to see that we control, first of all, so that we contain the spread. And we also see that we do not have high fatalities due to the cholera disease. Currently, you know, we've experienced a lot of rain.
Yes.
And when there's such rains, also managing the cholera, because we've said it's also transmittable by water, especially when the fecal matter that is already infectious mixes with the water, the storm waters. Or at times we have sewer bursts because of overload of the stormy water. And also when we don't have sufficient water at household, people have illegal connections. So with this all going on, then we can have different places experiencing the cholera outbreak.
Okay. So somebody would wonder then, what are the symptoms to look out for that can tell someone has cholera?
Cholera is very peculiar. We know it is accompanied by diarrhea. It could be with or without vomiting. So you could just have the diarrhea alone, or at times people will have accompanied by vomiting. The diarrhea is also very unique. Normally when you have diarrhea, maybe you have some abdominal pain.
Yes.
Or some rumbling of the stomach, or you feel like throwing up. Then after that you feel like you want to pass a quick motion. But with cholera, you cannot control it.
It just comes uncontrollably.
It just comes. So even if you try to walk to the sanitation block or to the toilet, there is no way you can control it. It just comes out. So that is one very peculiar aspect of cholera. As it intensifies, as you continue to diarrhea, then the internal mucosa of the gut and the intestines also starts to wear off. So you'll find the color of their diarrhea is like rice water stool. But this is when you've already had several episodes. With cholera, then you also get dehydrated very fast. If someone starts getting the diarrhea due to cholera and they do not continue taking water, and not just water, lots of water, You don't have to feel thirsty. You don't have to think of anything else. You just need to continue replenishing the water. If you don't do that, then you lose a lot of water quickly and you start getting very dehydrated. You start looking like you've lost a lot of your muscle tone. You thin out. You become dehydrated. When you look at someone's mouth, it looks dry. The eyes also look dry. They are not teary. And when you even look at the tongue, it looks like it's a bit furry. And the person will be very fatigued. And within those 4 hours, if not well taken care of, they can even lose their lives due to dehydration. So when that dehydration happens, you start getting other complications like renal complications, where the renal system will start shutting off, and also the blood becomes too thick because the content of water is not sufficient. You also lose other micronutrients in your body like potassium and sodium, so it can kill very easily.
Yeah.
Yes.
You know what strikes me in what you're saying, Lillyan, is that in 4 hours, the story could literally change and this person is gone.
And especially with the type of health-seeking behavior that some Kenyans have.
Talk about that.
You find if someone is having diarrhea, maybe they'll recall a drug they were given when they were having diarrhea, and they will send for that or buy themselves that medicine. Then previously, cholera was associated with the poor in society.
Yes.
So some people also feel guilt and shame to say that they suspect they could be having cholera. So self-medication, not accessing medical services immediately, and not dehydrating. Because once, be it cholera or any other diarrheal disease, whether it's a young child, a young adult, or an elderly person, whoever starts diarrheaing, the first management for you is to dehydrate. Just take a lot of water.
Yes.
And cholera itself, once you've started the diarrhea, it's not, even when you come to the hospital, it's not the cholera we treat. We treat the accompanying symptoms and any complication that may be setting in. So if you get cholera, just make sure you take a lot of water. And for those who are around you, they make sure they do not contaminate themselves.
Yes.
Either by touching the fecal matter, the stools, or the diarrhea for that matter, be it the linen that someone is sleeping on, or the clothes that they are putting on, or the environment that that diarrhea is in. We normally say that you should not touch it and contaminate yourself, because if you touch it and you touch any food or drink, or the same contamination on your hands goes to your mouth, then you are the next person who will get the cholera.
It spreads so fast.
Yes.
Okay.
So even if you see the response teams that go to maybe where the person is who is affected was, you'll find we are disinfecting the environment where the diarrhea is. If it is in the toilet, we have to disinfect that. If it is the clothing or the beddings. And with this, we do with chlorine.
Yes.
Chlorine is like Jik, but we use a higher percentage.
Okay.
Yes.
Yeah. If you're watching us, we're talking about cholera, and I'm hosting Lillyan Mutua. She's the head of health promotion, Nairobi City County. Do you have any question? Remember, our SMS line is 22232. Our WhatsApp line is 0708 222 Please drop those questions right there on our WhatsApp and SMS line. And you can also get us at Hope TV Kenya. You can share there your comment. And of course, remember to share this link. So let's look at some of the causes. What causes cholera outbreak, as it's termed?
Once we get the first case, it's termed as an outbreak. We don't wait for more.
Really?
Because if that one person has, they can spread it very easily.
Okay.
So one case, we notify, and immediately action is taken. So we have the disease surveillance response unit, which takes care of surveillance of notifiable diseases, which is at the national level and at sub-county level. And we also do what we call the community surveillance.
Yes.
In the sub-counties, we have the community surveillance, where we have engaged the community health workers and other leaders in the community including the administration officers, the religious leaders, local leaders. We've educated them about cholera. And once they suspect a case at the community, then they notify the nearest health facility or any responsible government officer. And from there, the information will go to the sub-county health management team, and it's taken to the county and to the national. So it's one of the notifiable diseases.
Okay.
Yes, and it's transmitted from, it could be from a source of water, from a source of food, and mostly because people are not taking care of their hygiene and sanitation, especially looking at the way we dispose of our fecal matter. We should use either a latrine or a toilet. So all fecal matter should be handled safely by using the toilet and the latrine. If it is the water, you should treat your water either by boiling or using the water guard or using the aqua guard, the aqua tubs. And for the water guard and the aqua tub, there is measurement how you will use. And mostly we look at if it is a 20-liter jerry can,
Yes.
how much of that are you going to use? And if it is water that is maybe a bit murky, you will be instructed even on the sachet of the aqua tub or on the water guard bottle how to use. We have interacted a lot with the community, and because they feel the fuel for boiling has gone really high, so we advise them to use the aqua tub or water guard,
Yes.
just to make sure that the water is safe. And once you have treated your water, you should also store it well kept. That is by, if you're using a vessel, if it is a jerry can, make sure it is closed. If it is a bucket, make sure the lid is on. When you're drawing water from the container that has the safe water, you must make sure that you do not contaminate. Especially, you'll find in some houses, maybe the children might just dip their hands,
Yes.
which are not washed, or they will take a container that is not clean and put it there, which means that you've already contaminated the water again. The other issue we have, especially in the urban setting, is illegal water connection. So some people tend to have some illegal water connections within the pipings,
Yes.
just to evade paying for the bills for water usage. So when this happens, maybe, and there's a drainage that is passing by or any other pipe that has the raw sewer,
Yes.
or any other contamination from the drain, then you'll find that it might seep in through that connection. And once that happens, then it means this water was chlorinated from the source, but to the household now might be contaminated.
Yeah.
In the urban, and also for travelers and people who are in maybe the shopping centers, we have also having rampant roadside cooking.
Now you're hitting at some people, you know,
And
my people who love eating as you
yes,
travel. Yeah.
yes, and also not only the travelers, but it's also become very common, especially for the youth. If you go to the CBD, you'll find the pasua eggs and the maize and mutura,
Yes.
a lot of things,
Yes.
the kebabs and what have you. But interestingly, no hand washing.
Oh yes. Now that you're saying,
And you
because I
can
touched the
imagine,
money,
yes, you've touched the money,
that,
you've maybe come from a vehicle, you've touched different surfaces, you just reach that point, and you see the delicacy, and you're already eating.
Yes.
The person selling to you has also handled money,
Yes.
has handled surfaces,
Yes.
handles your food, and you eat. For the hospitality industry, we know we do food certification for food handlers.
Yes.
And like Nairobi County is also gearing to go the same way for the small and medium entrepreneurs who are also doing this.
Yeah.
They should also be certified. We also are talking to them to start establishing the hand washing stations, just like we did for COVID,
Yes.
so that the person who is buying their food can always wash their hands before they eat, and also teach them maybe to use different apparatus for touching the foods that they sell. because you can imagine I'm touching the monies, I'm touching the surfaces, I'm touching the food, I've not washed my hands, I hand over the food to you and you eat it.
Yes.
So we also are coming up with an intervention in Nairobi where we will come discuss with them on how to make it better. And this is a stakeholders meeting.
Yes.
We have to know, we appreciate they're earning a livelihood, but can they also see that they practice sanitation and hygiene as they do their business? And we also are requesting at times like this when we're having the outbreak, not only as you eat outside, but always eat your food hot.
Why should it be hot?
Because the bacteria cannot thrive in that hot food.
Okay.
So you make sure before you handle, even when you're preparing the foods, wash the foods that are washable. There are foods that are eaten raw, vegetables and fruits. Make sure they are well washed. Wash your hands after you have washed them before you prepare again. Make sure the surfaces that you're placing those foods for preparation are also very clean, well kept. Make sure if it is foods that are eaten raw, once you have already prepared them, put them in a container that has a lid, ready for use. For the ones that you're going to cook, make sure you've cooked thoroughly. And serve your food hot. The ones that are eaten raw, make sure they are not contaminated. Where we are saying that, if you leave your food not well covered, the flies can touch on a surface that had the diarrhea.
Yes.
That is contaminated with cholera, lands on your food, lands on your drink, or on your raw foods, or on your fruits, and you consume. And then you'll be wondering, I've been doing the right things, I've treated my water, I've made my food safe, but you do not remember to cover that.
Okay.
If there are any leftovers, we request for that needs to be, that is cooked, kindly boil it again to a boiling point so that it's also served hot again.
Okay.
Don't put food on the side and eat it again. Just serving from whatever container it was and eating it cold. Make sure you boil it again. There are some foods which the cholera bacteria can thrive very well, like the rices, the pastas, and such.
Yes.
It can thrive very well. So with such food, it is good to make sure that if you cook a once meal so that you don't keep them, because if they are contaminated, the bacteria will thrive there very easily.
Okay.
Cholera does not respect age or sex.
Let's pause there. Cholera does not respect age or sex.
Yes.
When we come back, we'll pick it up from there. And I'll also ask you, Lillyan, you know, you're talking, at the beginning you said cholera was seen as a poor person's kind of a disease. I would want to know, so people who live in urban areas, cholera is here with us. What are we not doing right? It doesn't respect age or the status. So we'll pick it up from there. Allow us to pause here right now for a break. When we come back, we'll proceed with this discussion about cholera. I'll also be sampling some of your questions and comments. Our SMS line is 22232. Our WhatsApp line is 0708 222 323. And you can also get us at Hope TV Kenya on Facebook and YouTube. Keep it right here. We'll be right back.
Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV where you look and live.
Going back to the heart of worship.
Whether up the mountain or down the valley, we were created to worship God.
Enjoy carefully selected worship music every Wednesday all day long.
Oh, I will sing of the goodness of God.
Miracles happen when you move. We take it a notch higher with more worship music.
Every Wednesday
Is Worship Wednesday.
only on Hope FM. Listen and live.
Welcome back to Health Check right here, Top TV. Look and Live. My name is Grace Mutiso, and I'm hosting Lillyan Mutua, the head of health promotion, Nairobi City County. And we're talking about cholera. And this is the time we'll be looking at your questions and comments. Please engage with us. Our numbers are right at the bottom of your screen. And you can also get this conversation live on Facebook and YouTube at Top TV Kenya. So Lillyan, we posted the point where we're saying cholera does not respect age, sex, where you stay, it just comes. So most of us would think the slums is where prevalence is high, but you're also seeing in some high-end estates and high-end people have cholera. So what are they not doing right?
The measure is still the same. It's about sanitation and hygiene, and especially the hand hygiene. So we are urging all citizens to be vigilant and to continue washing their hands. You remember when COVID struck from 2020 to 2022, the incidences of diarrheal diseases went down. Why? We emphasized on hand washing.
Yes.
To help combat the transmission of COVID. And it helped, even with the diarrheal diseases. So it's very evidence, it's very factual, that washing hands plays a very major role. We've said that for one to transmit cholera, there must have been a person who had cholera and passed through or had diarrhea that has the cholera bacteria. So you can imagine if you are that person who is infected and you've not yet developed the signs and symptoms and you've gone for a long call and after that you've not washed your hands, what do you think happens thereafter? Anywhere that you touch, you are spreading the same infection. And why we say this is for you to have the cholera, you don't have to see so much feces. You don't have to see so much diarrhea. But just that amount that is on your hands, and you touch food or touch a drink or touch a surface and the other person touches that surface and takes something with their hands, then the contamination and the transmission occurs.
Yeah.
So the perception of some community members thinking within our status we are safe, within our age we are safe, that one you cannot negotiate. We have had incidences where breastfeeding children who are not yet even crawling get infected and the mother is not sick.
Oh, no. No.
So where has it come from?
Yeah.
Because the baby is not crawling.
No.
The baby has not handled surfaces. The baby has not gone to any washroom.
Yeah.
It means maybe this parent who is breastfeeding the baby touched a surface,
And
touched the breast,
breast.
and breastfed the child.
Oh, mothers, please don't do that.
So that is why we always say also for the breastfeeding mothers, take care of your hands. Before you breastfeed the child, make sure you wash your hands. I know when I was very young, we used to see our mothers wash the breasts
Yes,
before they feed the baby.
I remember my mother.
So right now the measure is wash your hands, not the breast. Because if you've had a bath and you've changed your clothes, the breast is always covered. It is safe. It is your hand that touches the breast and then causes infection.
Okay.
For the school going children, we have the school health program where we've done a lot of education in learning institutions from the lowest to the tertiary.
Yes.
Educating them about hand hygiene, about safe sanitation practices, about how they dispose of their waste and garbage, because we've also said that the fly is one of the areas of transmission.
Yes.
So there's a lot of education going there, and we've partnered very closely with Ministry of Education in Nairobi, very closely with all the stakeholders of education, and we have said in case there is any outbreak of diarrhea or suspected diarrheal cases within a learning institution, kindly inform the health services at the county, even if you're going to seek for any medical attention.
Yes.
Also inform us so that we can also come, do some inspection, see whether you have any maybe source of contaminated water, or how the kitchen looks like, or the dining hall, and even observe the behavior of the students and the people handling the food and the way the water is handled, especially the drinking water.
Okay.
And also the status of the ablution blocks.
Yeah.
So there's a lot of engagement right now going on within Ministry of Education and the health services.
Okay.
And also the hospitality industry, we do a lot of checks, and we are encouraging. I know when we go to most hotels or restaurants, you find that the hand washing sink is inside the washroom.
Wow.
So there is that one that is inside the washroom,
Yeah.
because people have to wash their hands after visiting the toilet.
Yes.
But we need to have another one outside.
Outside.
And we are also encouraging those who have not yet put the one that is outside as an immediate remedy. First of all, let us not, the outer door should not be closed. Because I wash my hands,
I'll touch
then
the
I touch
door.
the door again.
Yes.
And maybe whoever had touched there had not washed their hands. So the restaurant areas where people are eating, we are really encouraging to have outdoor hand washing sinks.
Okay.
And also have their food handlers certified, free of the transmittable diseases. We are also engaging very closely with all stakeholders, including the transport industry, and especially the borders.
Now that's a tough one.
Yes, we engage with them
Yes.
to report any patient that they have ferried to a hospital who has severe diarrhea.
Okay.
Why we do that, if it is a border, it's a taxi, if it is a matatu, and you let us know within the area that you are in, then your vehicle or your motorbike can also be disinfected.
Yes.
And we will also want to take your contacts and follow you up, because maybe you could also contaminate yourself.
And is this disinfection free of charge, or they have to make
free of
some
charge.
payments for it?
It is free of charge.
Okay.
And this is normally done by the public health department, and especially the public health officers and other officers that we call the WASH officers.
Okay.
Because they are in charge of hygiene and sanitation. We also are taking samples of the water at different points in the community and even at household, just sampling, taking them to the national laboratory, public health laboratory, to ascertain the status of the water. But so far in Nairobi, we've not found water to be contaminated with the cholera. So our most probable cause is the sanitation and hygiene,
Okay.
and especially the hand hygiene. We also are visiting the working institutions like the companies, the industries. We have done a lot of awareness in churches. We go to the communities and give a lot of health education. We have been in the malls, in the markets, in the matatu bus stops. So for Nairobi, we really want to thank the support and the encouragement and the efforts from our leadership, all the way from the governor, our CEC Health, our chief officers, the three of them, the various directors, and especially the Department of Preventive Promotive Services.
Okay.
They have worked tirelessly all the way from October to date, because if we do not tire in our efforts, you know, Nairobi is a transit hub, it is an international hub, it is an economic hub, people come from different places. More than 1 million people enter this city for travel, for business, for stopovers. So if we don't take care of our business in Nairobi, it could also be transmitted elsewhere.
I hear you. I hear you on that. So what is sort of a quick first aid that a family member can give if they discover there is one of them who has cholera-like symptoms? What should be the first action point?
So once a person starts having diarrhea, don't wait to confirm it's cholera.
And that, so how will you
The number one,
it from the one I have eaten something wrong?
Any diarrhea, first take water. And we have said for cholera, it is effortless.
Yes. Okay. Yeah.
That is the difference.
Yes, I remember. Yeah. It just
the
comes
diarrhea
out
will just come out.
Uncontrollably.
And it will not come out now, then after 2 hours. It is just continuous. And once that effortless diarrhea starts, anything you put into your mouth has to go out. And that is one of the things that makes people afraid of even taking water. Because you take in water, it comes out. You take anything, any fluid, any other fluid, be it porridge, it comes out. You eat a bit of food, it still comes out. So nothing is really retained. So once you have such diarrhea, suspect it is cholera.
Yeah.
Because the other types of diarrhea, you can try to withhold, but for cholera you cannot. So once this happens, make sure the person starts on fluids. If there is any shop or a chemist or a kiosk that has the oral rehydration salts, the ORS,
yes,
that we normally say is for babies.
Yes.
It's not for babies. It's for anybody who has diarrhea. It's not for babies. So you also mix that and take with your water as you head to the nearest health facility.
Okay.
The other thing we say is that always notify of a suspected case, so that once you have notified the health facility that is near you, samples can be taken and we can know whether it is cholera. And we also do the contact tracing and follow-up. That is, if you're in a household and we have confirmed it's cholera, we will also follow up the other members of the household and see how they are doing. And also try to take a recall. What do you think might have happened before you started that diarrhea? And also contact the same environment, maybe at a food eating premises, maybe at wherever you think you might have taken food or taken a drink. If it is, we think that it is from outside, we might want to take samples from that place. Like if it is in an institution and this has happened, we will collect water samples, we will collect the food samples. If it is a water tank, we take samples. If they have taps, we take samples. If it is in a food preparation place, we also take samples. We might even go to the extent of, if it is a food preparation institution, we even go to an extent of examining the food handlers,
yes,
just to make proper checks and ascertain and make sure that we are doing the right thing.
Okay.
Then we also make follow-up for recoveries and know how they are going on, because some of the people who come to the health facilities will come a bit too late and maybe they've already started having other complications like renal functions, or they may not be in very good state. So we also follow up and make sure they go to the lab as requested, they go to the special clinics if it is the medical outpatient clinic, and we also make sure that we support their families or their kin psychologically.
Okay.
For those who are also bereaved, we also give them psychological support. And within the community and within the household, we give a lot of health education so that this does not occur again. We also are using the social media. We are using the community radios and media houses like you.
Yes.
And we really appreciate that a lot of media houses are coming up now just to make sure that their listeners, their viewers are informed about cholera, so that they can also support the collective action of control of the cholera outbreak.
Okay.
We know other countries out of Kenya, like Malawi, where they were hard hit because of the floods. And we know for them, the floods were not, they were very heavy. And Mozambique and part of Zambia, because of the flooding, the raw wastes from the latrines and the toilets and the sewer systems were mixing with the stormy water. So it was diverse. So when we tell our citizens to take control of their action, to take control of their health, like what the CHVs will tell you at the community level, afya yako ni jukumu yako.
Yes.
Because there's only this much that the government can do. There's this much that the county can do, but there's what also is citizenry responsibility.
Okay.
Because for that person who is doing illegal connections of pipe, for that person who is not washing their hands, for that person who does not want to keep their water safe or food, we cannot policy at personal level.
You can't.
We cannot.
True.
So it's a collective action with all players from the community, from different line sectors, from different ministries. If you see an open sewer, kindly notify the county authorities.
Is there a number like people can call? Of course, you're saying about sewer, open sewer, but you've also mentioned if you've noticed someone who has these symptoms, you need to notify. Is there a number?
Because cholera is a disease, we always say we have an emergency number.
Yes.
For the Emergency Operations Center for Health Services, 1508.
1508.
And it's not charged for you to call.
Okay.
You just call, you notify them, even if you've seen that burst sewer pipe, or you've seen a clean water pipe that is flowing off, or it is burst, or it is tampered with. If you notify us, we are able also to link up with the Nairobi Water and Sewerage Company for quick action.
1508.
1508. And we also appreciate Nairobi Water and Sewerage Company because of their swiftness and effectiveness of coming to work with the health department to combat all this.
Okay. Before time catches up on us, let's talk about vaccine, cholera vaccine. Would you want to touch on that and who is eligible to get it?
Yes, we had the cholera vaccination campaign that happened in February.
Yes.
And this happened in 4 counties, that is Nairobi, Tana River, Garissa, and Wajir. And in each of these counties, we had 2 sub-counties that were earmarked, the ones that were reporting higher numbers. And this was to curb the spread within these counties, which were having very high numbers. And we really appreciate that most of the citizens were coming forth to have the vaccine, though it was a new vaccine.
Yes.
But they appreciated the vaccine and they came in numbers. And we know that we only gave 1 dose. Normally, the cholera vaccine is given in 2 doses. And we hope, because it's also very costly for Ministry of Health and the national government to bring this vaccine, because it's an emergency vaccine. It will only be issued when there's an outbreak by the ministry. It's not within the routine vaccination, but it's given as an emergency. So we're hoping that if we are not getting control of the cholera outbreak as at now, we hope that the ministry will be able to look into it and guide us, because it is with the guidance of Ministry of Health, the national government, and World Health Organization. They will guide us on whether we are going to have a second dose and whether we will cover only those 4 counties or more will be added. Because what we have seen is that 23 counties have been affected, but when you look at the incidence, the type of cholera we are having now, it's not where we get a cluster in the community with so many numbers. It is sporadic. And they will guide on this. So we give children, and anybody above 2 years will get the vaccine.
Okay.
Yes.
And where can they get it?
This was only delivered during the campaign.
Okay.
So we were in the community, giving in the community.
Oh, you're the people with
Yes,
yellow,
yes,
the
we were
yellow jackets,
yeah,
sort
yes.
of. Yes.
We were vaccinating in the communities. So I know we started off with the yellow, but we also had the white aprons.
Yes.
And we also had the Red Cross mobilizers on board. So when this team goes around, we have the vaccinators, that are the nurses who vaccinate, and we have the CHV, the community health volunteers, and the Red Cross volunteers, who are guides in the communities. But for once, this is one of the campaigns that was done with a lot of ease. I remember I was supporting Mathare sub-county.
Yes.
And we had people traversing from other sub-counties to come and get the vaccine because they know how fatal cholera can be. So we also really urge, when we're having other campaigns, can we also see that uptake? Can we see people appreciating and trusting the services like they did for the cholera vaccine? I know in Nairobi we did more than 100% of the targeted population, and we had to borrow more vaccine. So we really appreciate, and not only for cholera. I know last week we've just finished the immunization week,
Yes.
the World International Immunization Week. And when we look at our coverage for other vaccinations, we are not doing very well. For COVID, we appreciate again. I'm proud of being in Nairobi Health Services.
Yeah.
We were living at 57+%.
Yes.
So we had the #1 for COVID-19 for this period. We know we are supposed to be doing at 100. As much as the sanctions have been put down, but it does not mean that we don't need the vaccination. Remember, we have not reached a place of herd immunity where we have at least 95 and above people vaccinated. Nairobi is doing at 57. Other counties are doing below 15%. So COVID is still there.
Yes.
We still report COVID cases, even in Nairobi. We once in a while get people very critical, admitted in ICUs. We are not yet off the hook.
Yes.
Let us not misinterpret information that has been given.
Okay.
Because WHO has given a statement. There are countries where people have done a higher percentage of vaccination. So when we are saying maybe we are where we are, maybe in our county or in our locality, we are not doing well, we will not think because Nairobi is at 57, all of us are safe. Nairobi is not yet even safe. Our target by December last year was to reach 70%, and after review, we're supposed to be at 100%.
Okay.
Let us also take caution of the elderly,
Yes.
people living with comorbidities, people with disabilities. If they get COVID and they're not vaccinated, it really takes them down. We know that we've done a lot in the schools, but the young people between 24 to 35, that age was a bit resistant. But let us also know that they could get the infection and infect others.
Yes.
We have other immunizations, vaccines for HPV. We've seen what HPV is doing. It's the second killer, especially amongst women because of the cervical cancer.
Yes.
And you get to get the cervical cancer when the infection has been with you for many years. And most of the parents, most of the guardians and caretakers, and the religious, some of the religious leaders, some people in some circles, community circles, they do not understand why we are giving a young girl as young as 10 the HPV vaccine. So at times they resent for their daughters or young girls in their families to get this. And there's a lot of misinformation within the society and community groups.
Okay.
If a young girl gets this vaccine between that age of 10 to 15, then she starts to build the immunity against the HPV vaccine, virus.
Yes.
HPV virus is sexually transmitted. So it prepares her before she matures and starts getting sexually active. She'll be protected from the HPV virus.
So this one also they can get where? They have to go to any government
Any
hospital?
government
They are able
facility
to
you'll
it.
get.
Okay.
And the other misinformation is that people think it's a new vaccine. For the routine vaccinations within the public facilities, it was introduced in 2019.
Oh, okay.
But the private facilities have been giving it,
Oh.
and at a cost.
Makes
and they
sense.
give both boys
And
and girls.
I hear you.
Yes.
Okay, thank you. Thank you so much, Lillian. We have to call it a day right there. But one thing I'm picking is if you've noticed someone has cholera symptoms, and if there is any sewer breakage around you, the number to call is 1508.
Yes.
And you'll be able to get help.
And
Thank you.
whoever suspects to have cholera,
Cholera.
take plenty of water.
A lot
even
of
as
water
call
as
us.
you head to the hospital and as you call Lillian
Yes.
and her team. Thank you, Lillian. God bless you for the excellent work you're
God
doing.
bless you too.
We celebrate you.
And thank you for engaging with Nairobi County.
Most welcome. We celebrate Nairobi County. It's our county. We love Nairobi County. Yeah.
Amen.
And say hi to
Amen.
Governor.
We will.
Okay. Okay. Thank you so much. You have to call it a day right there, and still emphasizing if there is a sewer leaking around you, or if you have any symptom of cholera as you've spoken, or you have a loved one who has that symptom, the number you need to call is 1508. That is 1508. Take plenty of water as you head into the nearest health facility. My name is Grace Mutisa. I wish you a blessed night. God willing, let's do this again next week on Tuesday, same time, same station. Of course, a different guest as we focus on matters health. Have a beautiful one and keep it at Top TV. Look and live. Shalom and God bless.